All right, I am starting.
Hi, everyone, and thanks for joining us tonight for a virtual family forum about the pediatric COVID-19 vaccine. I'm Dr. Rebecca Bell. I'm a pediatric ICU doctor at the University of Vermont Children's Hospital in Burlington, and I'm currently the president of the Vermont chapter of the American Academy of Pediatrics. And so tonight we have with us from Springfield Health Center Pediatrics, Dr. Sarah Weidhaas. And Dr. Weidhaas is going to talk to us about this vaccine. And we've had lots of parents have lots of questions. So she's going to give a presentation and show some slides and review a lot of the very common questions that parents and families have had. And then afterwards, it will probably take about 20 to 30 minutes for her to go through all of her information. And afterwards, we will answer questions. So at any point, feel free to put your questions in the Q&A box. Some of your questions may be answered during Dr. Weidhaas's presentation, but we will get to as many as we can. And just so you know, no one else can see your questions. And so these are anonymous, and feel free to really ask away. I also want to thank Jordan, our closed captioner, and Virginia, our ASL interpreter, who's here with us tonight as well. So I'm going to hand it over to Dr. Weidhaas.
Thank you. Okay, so I'm going to go through some slides here. And this is really presenting some of the similar information if you had any kiddos that are older in the teenage age group and you were here for any of those presentations on that age group vaccine, it's a similar type of information. So some of the common questions that we get from families, and hopefully you'll get some answers to this evening, is does my child need to get vaccinated? What are we protecting children from when we vaccinate them? And what are the risks of that vaccine? First, let's start with how the COVID vaccine works. It works the same in children as it does in adults. So what we're protecting against is the SARS-CoV-2 virus, which is the virus that causes the COVID-19 illness. And this virus invades the body and it will multiply in the body, which causes you to be sick. And depending on how much it replicates within your body is how sick you may get. The vaccine stops this by helping the immune system make special proteins called antibodies that help fight off that virus. So after your child is vaccinated, they have less of a chance of getting COVID-19. But also if they do still happen to get COVID-19, their symptoms will be much less than if they did not get the vaccine. How effective are these vaccines? So the research shows us that the COVID-19 vaccines are highly effective at stopping people from actually getting COVID-19, but also really helpful at preventing severe illness, hospitalizations, and death if people do get infected. We don't really know how long the immunity lasts from the vaccines, but it's becoming clearer as time goes on. The type of immunity that we have and how long it will last. And a lot of questions stem around how do we know the vaccines are safe for use in children? And that's just been shown through studies and also just through people getting vaccinated in this country and around the world. They've been shown to be remarkably safe and effective for adults and in the age groups from 5 and up. There's been randomized placebo-controlled trials that were performed in each age group, and each of those studies showed that the vaccine is not only very effective, but it's very safe. And they continue to be monitored. So anytime there's an adverse reaction to a vaccine, or there's a new side effect that a parent or person noted, the CDC is notified, and that's recorded. And of note, if you think back in history of all the vaccines that have been developed and monitored for safety, this vaccine, because of the pandemic, has been probably the most rigorous safety monitoring that any vaccine has ever gone through. Here's just a timeline of the first vaccine rollout to now. So it was December of 2020 when we first got the emergency use authorization for adults for the COVID-19 vaccine, and that was for the Pfizer vaccine. And then in May of 2021, that emergency use authorization was moved to the 12 to 15-year-old age group. In August of 2021, there was full FDA approval of the Pfizer vaccine for adults. And then just this November 2021, there was an emergency use authorization for children aged 5 to 11 to receive a pediatric dose of the Pfizer COVID-19 vaccine. And just since that November date for children, as of December 14th, over 5.5 million children of that age group 5 to 11 have received at least their first dose. In the US, over 100 million people have actually been fully vaccinated with at least 2 doses, and 15.7 million youth, 12 through 17 have been fully vaccinated. So what's different about the Pfizer vaccine for the younger age group 5 to 11? The main thing is it's a smaller dose. So the adult and adolescent vaccine is a 30 microgram dose, and the smaller dose is just 10 micrograms, which was shown in studies to have the similar immune response as the higher dose in older individuals. And the efficacy of that dose in the studies is around 90.7% effective against COVID-19 infections. And that data, it's important to know, that was collected during the Delta wave. So a different variant than the original SARS-CoV-2 virus. And there has not been any serious adverse events related to that vaccine. This is a study overview of pretty much how the process begins and runs when we look at vaccines and determining what the vaccine is going to be, what the dose is going to be, and how effective it is. So phase 1 is just that, finding the dose. So for 5 to 11 age range, they studied doses of 10, 20, and 30 micrograms. And then phase 2, once they determined that dose was going to be the 10 micrograms, they moved on to the phase 3, which is your randomized trial, where they give a select group of children that 10 microgram dose and another group of children a placebo. And I believe in the next couple of slides, we're going to go over what they noted in that phase of the study. Or it might be in a couple slides. So, okay, so side effects. So some people didn't have any side effects at all. The most common side effects for those in the age range of 5 to 11 are mostly localized pain. So pain at the injection site, some redness and swelling. And then some children, after they're more common after the second dose, are having some more headache, fatigue, and myalgia symptoms. Most of them are mild, and we're going to show you some of those numbers in the next coming slides. And it's also important to note that those side effects are very temporary, usually lasting a few days, and then they're completely gone and children are back to feeling well. So these figures are showing the percentage of localized reactions. So this is specific to at the injection site. So some tenderness, swelling, and it breaks it down into mild, moderate, severe. And the top line is after the first dose, this bottom line is after the second dose. And each of the columns, you can see the 10 microgram, they compared the 10 microgram with the 30 microgram dose, and then with a placebo. So it shows really with the 10 microgram dose, compared to both the placebo and the 30, localized reaction was present really in all of those groups with redness. It was very mild. And then you also saw that same with swelling. The biggest difference when it came to placebo versus the actual dose of the vaccine was the pain at the injection site. So there was, to be noted, more mild pain at the injection site in children that actually got the vaccine than the placebo, but it's important to note that children still had some of that pain in the placebo group. And then you also look at the second dose in the bottom line, and it's similar findings, pretty comparable to the first dose as far as pain at the injection site. And then this slide shows more of the systemic side effects. So what are those? So fever, fatigue, headache, chills, vomiting, diarrhea, muscle aches, and joint aches. And the top line is the vaccine group, and the bottom line is the placebo group. So again, I just want to point out that even in the placebo group, there were notes of people complaining of some of those symptoms. More so in the actual vaccine group, and you can kind of compare. Again, it breaks it down. The green is mild symptoms, the blue is moderate, and there actually wasn't really any note of severe reactions in either of the groups. The most common systemic event noted was fatigue and headaches, and chills. Less common were fever, vomiting, and diarrhea. This is a really common question that parents have and a concern that parents have. It's been present a lot in information that you read online or from the news. And it has to do with the heart inflammation post-vaccine or post-COVID infection. So just of note, there were no cases of myocarditis in the 3,005 to 11-year-olds who received the vaccine in the trial. However, we do know that there is an increased risk of myocarditis, that's inflammation around the heart, in that 12 to 17-year-old, specifically male group, after the second dose of Pfizer. Even then, the rate of that is very low. So even in the group most effective, which is the 16 to 17-year-old males, that rate after the second shot is about 1 in 10,000 or 0.01%. And then even less than that in the group for 12 to 15, it was less than 30 to 170 cases per million after the second dose for that lower age group. And this is important to note. We have vaccine-associated myocarditis, but there's also that infection-induced myocarditis. So if you actually get infected with COVID-19, the risk of getting that same response from the virus or a more severe response. So we know that viruses, including COVID-19, can cause myocarditis in children. And your child's more likely to get that adverse event happen if they get infected with COVID-19 without being vaccinated. The vaccine-associated myocarditis has been shown to be a much more mild case than those who have been infected with COVID-19 and therefore get the myocarditis. So when you think about whether or not to get a vaccine for your child, I always think about it in comparison to actually getting COVID-19 and what is the risk. So the risk is always going to be less with a vaccine that's controlled versus a virus that can kind of replicate unchecked within your child's body. What about late onset side effects? This is a really common question and something that parents are also very concerned about are what are the long-term effects of this vaccine? And just to kind of think about, we really don't have any long-term side effects from vaccines. And at this point, the COVID-19 vaccine has been in the population since December of 2020. So we really haven't seen any of those long-term considered side effects. And there's really not a biological mechanism but that the vaccine could cause a new long-term problem. And that's mainly because the mRNA that's in these vaccines gets broken down very quickly by your body after you've gotten the vaccine. Okay, so what are the risks of COVID-19 infection in the 5 to 11-year-old age group? So this is national data. Greater than 8,300 hospitalizations have occurred in that age group since October 2021. And approximately 1/3 of those hospitalized children in that age group have required ICU admission. This graph is the COVID-19 deaths by age, ranging from January 1st, 2020 to October 16th, 2021. And it shows that children aged 5 to 11 years, there's been 94 COVID-19 related deaths. At 1.7% of all deaths among children are age 5 to 11. So of note, if you look at the statistics and leading cause of deaths in that age group, COVID-19 is actually sitting at about 8th for leading cause of death in children age 5 to 11. This is a look at the Vermont cases updated December 12th. And you can just see that children make up a larger percentage of Vermont cases currently, as would be expected, because that is the age group that has not been vaccinated as part of the population, because we started with adults. So it's expected that the unvaccinated are going to have higher case rates, which is why we recommend so strongly that we get that age group vaccinated as soon as possible. Again, this is the Vermont cases, the rate by week by age. So that 6 to 11 age group has just really kind of skyrocketed as expected. There's been a recent downward trend over the last month or so, and that probably reflects some fewer tests being done over the holidays. Since the positivity rate actually increased at that time. So we were getting more positives, but less testing happening. And this is a chart of the cumulative COVID-19 cases per 100,000 children. It's calculated using state level population estimates from the US Census. Overall, 9,562 child COVID-19 cases per 100,000 children in the population. 11 states reported more than 14,000 cases per 100,000. So Vermont has had the lowest cumulative pediatric COVID cases than many other states. And we've been really lucky that Vermont has been able to do that. This is a map of the US, and it's showing children aged 12 to 17 who have received at least one dose of the COVID-19 vaccine by state of residence. So second to Massachusetts, Vermont's the highest percentage of adolescents vaccinated. We have just around 31,000 adolescents aged 12 to 17 that have received at least one dose of that Pfizer vaccine. So that older age group has done really well getting out and getting vaccinated in Vermont when compared to the rest of the country. And we're hoping the same holds true for the 5 to 11s. Pediatric COVID pneumonia. So this is when you have your COVID-19 infection and it affects the lung tissue, and it can lead to low levels of oxygen in the body, which can require your child to stay in the hospital so that they can get some supplemental oxygen to help them breathe. It can also result in mechanical ventilation if the infection in the lung tissue is severe enough. It has happened that children have had to be put on ventilators, and also ECMO, which is something that helps oxygenate the blood. It takes blood actually out of the body, oxygenates it by a machine, and then puts it back in. We're very lucky in Vermont that we have not had any pediatric patients in Vermont who have required any mechanical ventilation or ECMO. Severe cases of COVID among adolescents. Our high vaccination rate in adolescents has really protected our Vermont children from severe COVID-19 vaccine, COVID-19 disease. When we saw cases rise due to the Delta variant across the country, we were very lucky that we had a pretty high rate of vaccination among the adolescents in Vermont that helped protect the younger children as well. Because when you have a higher rate of vaccine within your population, you have less viral replication and therefore less disease, less severe disease for the people that are not yet vaccinated. And that holds true in the data because it shows that your unvaccinated adolescents are actually 10 times more likely to be hospitalized due to COVID-19 than the vaccinated. That's nationwide data. We'll talk a little bit about the multi-system inflammatory syndrome of children that has been seen around the country. The definition of that. So you have to have certain labs done that show inflammation. There has to be evidence of severe illness that requires a child to be in the hospital. And you have to have 2 or more organ systems involved. So for example, myocarditis, that inflammation of the heart muscle may present and may be severe in this multi-system inflammatory syndrome. And of course, you have to have a recent COVID-19 infection. So how often is this occurring? So in the US, there's been 5,973 cases and 52 children have died due to this inflammatory process. This is the incidence of this inflammatory syndrome happening in children based on their age. So it is most frequent between the ages of 5 to 11, which just shows the importance of getting this age group vaccinated to decrease the risk that we're going to have more of this awful syndrome affecting our kids in Vermont. So this is a model that was made to estimate the benefits for every million Pfizer vaccine in children aged 5 to 11, using the recent incidence of COVID-19 that's circulating. So in females aged 5 to 11, it can be predicted that just over 57,000 COVID-19 cases have been prevented. 191 hospitalizations, 130 multi-system inflammatory disease of children cases prevented, and 60 ICU bed admissions prevented. Similar numbers, but slightly higher as far as hospitalizations go for males in that age group. You can take a look at those numbers there, but they're pretty staggering and pretty significant numbers that of severe illness that can be prevented by this vaccine. So weighing the risks and benefits of vaccines for your 5 to 11-year-olds. That's really how you make the decision whether or not you're going to vaccinate your child. So the CDC created a model of multiple scenarios to try and analyze the risks and benefits. We know that it's pretty difficult to make accurate models with COVID-19, but this is kind of the attempt at that. So it breaks it down into benefits and risks. So benefits, obviously, we're going to stop and prevent COVID-19 cases and infections. We're going to prevent the hospitalizations due to COVID in that age group. we're going to prevent kids from ending up in the ICU and prevent children from dying from COVID-19. Those are pretty clear benefits of vaccinating kids age 5 to 11. And then they broke down some risks. So, and it really comes down to the myocarditis risk. That is the only risk really in children that has come up as far as the vaccine. So, the risk of causing excess myocarditis cases, excess and hospitalizations due to myocarditis, ICU stays, and death. It's important to put that into perspective, and kind of next to it, put your risks of the COVID-19 virus causing myocarditis, right? So we know that myocarditis is a risk with a very specific age group and in the male population with the vaccine, but we know that risk is higher for children of all ages and all genders if you actually get infected with COVID-19. So it's always important to keep everything in perspective. And then in that kind of model, we think about factors not considered, right? So hospital stay for vaccine-associated myocarditis is much shorter after a vaccine than a COVID-19 infection. They've noted through studies that the vaccine-associated myocarditis in that very specific age group is a much milder course, requiring less hospitalization and quicker recovery. Benefit that vaccination will have on the transmission of COVID by children. This factors into what I said previously about it having more vaccinated youth, adults in a population is just going to decrease the ability for the virus to replicate. And it's going to decrease how sick people get and how many people actually get COVID, because you're decreasing the transmission rate. And getting kids back in school, right? We don't want kids to have to be out of school because of illness or because of exposures from COVID-19. So if we can reduce the transmission, reduce the cases, we keep kids in school. And the other thing that's really important to consider is the post-COVID-19 conditions, and what you've probably heard is long-haul COVID. We know it affects adults, but we also know it does affect children, and there is a risk of having post-COVID fatigue, headaches, and other illnesses that can last sometimes months. So when the FDA had to review the data on the COVID-19 vaccine for this age group, they had a question and they had to vote on it. And that question was, based on the totality of scientific evidence available, do the benefits of the Pfizer BioNTech COVID-19 vaccine, when administered as a 2-dose series, outweigh its risks for the use in children 5 to 11 years of age? And clearly, because we are now vaccinating that age group, that vote was to vaccinate, because we know the risks of vaccine are significantly less than the risks of getting COVID-19. This is a really common question, and the answer to it is actually more simple than you think. The question is, why is a vaccine dose based on age and not weight? Because we do a lot of our medications for pediatrics based on their weight. And it has to do with the immune system. So vaccine dosing is based on age, not weight, because it has to do with the immune system, and the immune system matures based on age, not weight. So younger children, they have usually a little bit of a healthier, robust immune system, so they require less of a dose for their immune system to recognize it and do its thing. So that's why vaccines are based on age, not weight, whereas medications are metabolized differently in our body, which is affected by weight. What about Vermonters and children under the age of 5, when can we expect to see a vaccine for the younger kids? And are we, how far away does that look? So the trials are underway, and they're starting at age 6 months, right up to the age of 5. They're testing smaller doses for those children, again, because those children most have very robust immune systems, so probably don't need as much of a dose to get similar response. We're hoping that the 2 to 4 age group data will be submitted around the end of December. So potentially having vaccine available late January, February is a hope, but there can always be delays. What about getting the vaccines, COVID vaccine with other vaccines? It's definitely okay. And we do recommend, if your child is due for other routine vaccines or flu vaccines, to please get those vaccines along with the COVID-19 vaccine. Delaying childhood vaccines just puts them at risk for other disease. So we're also getting ready for our flu season this year. So if your child is due for both their flu vaccine and their COVID vaccine, be reassured that you can do both at the same time. And just a little bit more information. It takes 2 weeks after getting your second dose for your body to really have a robust immune response and to be considered to get your full immune response from that vaccine. So just a reminder, the first dose, you get your second dose in 3 weeks, and then 2 weeks after that second dose, so a total of 5 weeks, is when you're considered to have a full immune response. And then COVID-19 vaccines are free. So whether you have health insurance or not, you're eligible to get a COVID-19 vaccine at no cost. The Department of Health has COVID vaccine registration sites. So you can sign up through VDH to get a vaccine. They're being offered at school clinics. Some pharmacies have the pediatric vaccine. There's different community sites that are offering a vaccine for children aged 5 to 11. In Springfield, we have the vaccine in our office. We're able to give children 5 to 11 their first and second dose. You can just give us a call and we can set you up for a nurse visit, or we also have some designated COVID-19 clinic days as well. This is information about finding a vaccination site near you. The link is on the PowerPoint if you wanted to click on that and get registered for an appointment. You can also call the call center to get more information or help making an appointment. And then this is resources for families. So just information about COVID-19 vaccines, information about COVID-related topics. The Vermont AAP, American Academy of Pediatrics, all have great resources where you can find a lot of answers to questions that you might have about COVID-19. And again, this is the Vermont Department of Health website, information on COVID-19 vaccines for children, gives you some information for parents, talks about the vaccines, how to get vaccinated and where. So it's a great resource if you just go to the Department of Health website. And I believe that's it. We'll open it up to some questions.
Thank you so much, Dr. Weidhaas. For those who joined us a little bit later, that was Dr. Sarah Weidhaas. She's a pediatrician at Springfield Health Center. And I'll just, again, for folks who joined late, this is being recorded. And so folks can watch this later, any of our other presentations from other pediatricians across the state. So we have a few questions for Dr. Weidhaas, and for anyone can put any questions in the Q&A section. And just a reminder that those are all anonymous, no one else can see it, so feel free to ask away. And we'll probably chat for 20 minutes, Dr. Weidhaas and I, about questions that folks have. So the first question, and it's funny, I've been moderating these for a few weeks, and this wasn't a question before, and now it's becoming a question, is Omicron variant. Does that change anything? Are you making any different recommendations? Are you telling people to wait? Do people feel like, do you think that the vaccine will work against this variant?
Yeah, so I think it's even more reason to go and get vaccinated as soon as possible. Yes, it seems like some variants are a little, vaccines are a little less effective as far as preventing actual infection. So you may get COVID-19 vaccine and not have any symptoms or have mild symptoms if you get the vaccine and get infected with a variant. The vaccines still seem to be very effective against severe disease, regardless of the variant. And it looks like that's going to be similar with the Omicron variant as well. So when it comes to getting vaccinated, I think the variants are just even more reason to get vaccinated. The less replication we have, the less likelihood there are going to be more and more variants.
And Dr. Weidhaas, I think you participated in we did this for the 12 to 15-year-old age group in the spring, and just thinking back to that time, because really that was pre-Delta, at least pre-Delta in the US. Cases were coming down, and some parents were saying, well, maybe this is going to go away.
Yeah.
And I feel like things are so different, because now it truly is the case that we're all going to be exposed to COVID and get COVID. The question is whether or not we're vaccinated. So
exactly.
Have you noticed that trend in your practice as well?
Yeah, there's more acceptance that COVID is probably going to be with us for a long time. And the option is, just like you said, we're either going to get infected with COVID-19 vaccine, and your option is, do you want to get infected with some protection, or do you want to get infected with not having a vaccine? And we just know that if you get vaccinated, you're less likely to end up in the hospital. Yeah, so definitely seeing more and more people wanting to get vaccinated.
So along those lines, you mentioned there's more COVID. Somebody asked, my child had COVID infection recently. Should they get vaccinated, and when? When would you recommend they get vaccinated?
Yeah, so vaccines recommended as soon as you're feeling well. So some kids have zero symptoms. They test positive for COVID-19 and they're running around feeling better than I feel on a good day. They just have energy and they feel good. So if your child tests positive for COVID, they don't have any symptoms, go get vaccinated. The only reason you shouldn't get vaccinated is if you're feeling ill with COVID. And why, I get that a lot. Parents ask, why get vaccinated if my child or I already had COVID? And the answer is you have more of an immune response if you get COVID again. We know that we can get COVID more than once because of the variants now. And we know that the vaccine immunity is better than natural immunity for preventing that severe disease. So I always say, if you want to get vaccinated after you've had a COVID-19, you pretty much have like a superhero immunity to COVID.
Now, what about children? What do you recommend for children in this age group who are pretty anxious about getting shots, especially with this being a 2-dose regimen?
Mm-hmm.
How do you recommend parents approach or talk or think about the first dose so that they can make the second dose happen as well?
Yeah, so I think the most important thing is knowing your child and knowing where they're comfortable. Some kids are, they'll come to the office and they know they want a specific nurse to give them their vaccine. And that's fine. We're definitely okay with that. In the Springfield area, if you don't want to take your child to a pharmacy or a school clinic because they'll do better with someone that they know, give us a call and we can accommodate that. The other things that we do in the office is, if kids want to bring in their toys, we've got extra toys and stuffies in the office. If it makes them feel better, we have the the needle blockers and things like that, just to make it more less scary for vaccines. And I think the most important thing when you're talking to your kids about it is just being honest, right? Telling them that it's not going to hurt probably is not the best option, because after their first dose, they're going to know that it hurts a little bit and they're not going to want to go back for their second. So being honest that it's going to be a bit of a pinch, but it only lasts a second, and just being honest about the process and how important it is for them to get it. I think kids are more, we don't give them enough credit for understanding how it feels to be sick, and kids don't want to feel sick. So if you explained it to them that it's protecting them from getting sick and feeling icky, they understand that. And a lot of kids will be a little bit more comfortable with getting the vaccine and actually want to get it. Some kids I've vaccinated in the office and they've been so excited that they got their COVID-19 vaccine, and it's just really great to see.
I'll share that my 6-year-old got both of his vaccines. And he did say it felt like a bee sting,
Yeah.
but actually said incept instead of accept. Except with a bee sting, you don't get anything from that. So I think I agree, like being honest, but then saying this is the benefit, there's an actual benefit to it. I think it's really helpful. Yeah. What about for parents who have those kids under, I was excited to get my 6-year-old vaccinated. I have a 4-year-old too. So what do you recommend to families who are excited to have, their 7-year-old vaccinated, but they've got a 3-year-old at home, and they're just waiting?
Yeah. Waiting is hard. So I can relate because I have a 2 and 4-year-old. So we're not there yet, but hopefully we'll be there soon. So I think just stay positive, knowing that it's coming. We'll get there. In the meantime, anyone you talk to and having a conversation about getting, if they, somebody that has children that are in that age group to get vaccinated, the more that we get those kids vaccinated, the safer the younger age groups will be. So I think just stay positive, it's coming, and be open to conversation with other parents about the older age group getting vaccinated, because that's our safety net right now for the younger kids.
We sometimes get questions from parents saying that they have a child who's now of age, is 5 years old, but was born premature and is really small, like a very small 5-year-old. Is it still okay for them to get this vaccine? Is it safe for them? Do you recommend it?
Yeah, so I do. And I actually recommend it even more strongly, because especially if they were a premature infant, a lot of premature infants have some residual lung disease, can put them at higher risk of getting sicker from COVID. So I definitely recommend that they get the vaccine when they're eligible. And then as far as the dose, if they're smaller, again, it plays back to how the vaccine works. It's not metabolized the same way as medicines are, which we dose by weight. It has to do with their immune response, and that's age dependent, not size dependent.
So you mentioned that you would recommend your patients who have some underlying conditions like even more strongly to get the vaccine. On the other end, what about the really healthy kids? They've never been on antibiotics. They get over colds really quickly. They've never, been hospitalized. Do you recommend the vaccine for this group?
Yeah, and I can kind of talk about that in 2 parts. So the first part is, again, I think about it and you just compare the 2 situations. So vaccine, it's a controlled entity, it's an injection that we know is broken down very quickly by the body. And we know it's a very controlled reaction to that vaccine. Whereas your COVID-19 infection and virus is wild, right? So you may get infected with the COVID-19 virus, and it replicates just a little bit in your body and you don't get that sick, but we have zero control over that. So if you want to, you have something that's very controlled, we know what the response is going to be in your body. And then we have the wild virus that can pretty much do what it feels like on that day in your body. That's kind of how I think about it. And which would you prefer your child get? When it comes to my decision, I definitely want that controlled vaccine versus that wild virus infecting. Even, there's the chance that it might just be a runny nose, but there's always that chance that on that day it decides to replicate a whole lot more and your child ends up in the hospital. And then the second part of that is, depending on what your situation is, and you may have somebody in your family or in your community that is severely immunocompromised and their immune system is not going to mount a response to the vaccine. So they may have gotten vaccinated, but they're still at high risk of getting really ill or possibly passing away from COVID. Vaccinating your child is going to help protect them because it's just going to decrease the risk of passing that virus on to somebody that can't be protected from the vaccine.
I'm going to add a little bit to that too, if that's okay.
Yeah.
So I also think about, so when I take care of patients in the ICU, oftentimes that whole viral replication piece that you mentioned is not even the biggest problem anymore.
Mm-hmm.
So we know lots of folks have heard about medications and other types of treatments that we give COVID-19 patients, and it has to be early on. And those are oftentimes directed at, halting the virus and stopping the virus from replicating. But oftentimes what we see is really the problem is that the immune response is overwhelming, is too much. And so when we think about the treatments for COVID, I think people listening might recognize that we treat with high dose steroids and that we treat with other immune modulators. And that's because it's the immune system that's actually causing all the damage. And I really liken it to, again, a very unprepared and surprised immune system that isn't ready for it. They've never seen it before. And they kind of over responds.
Over accommodates. Yeah.
Yeah. And so a lot of the damage that we're seeing is actually the child's own immune system saying, I don't know what this is. I've never seen this before. And they over respond. And that's really, when we're treating severe COVID pneumonia, we're using these medications to help calm down the immune system. And MIS-C, which you talked about so nicely, that's what that is. That's the immune system saying, what is this? And then sort of responding in an unusual way.
Absolutely.
Yeah. So one more question, and that is just how, we hear this a lot from families, and they say they really appreciate the information. And then they still say, there's just an unknown here. This still feels new. It still feels like I know millions of children have received it now, but how do I know that this is the right decision? I'm the parent. I have to make this decision. Help me out with that. What do you say?
Yeah. And I mean, honestly, my only response that I can give to that is, as a parent myself, what my choice is for my own children, knowing that as soon as the vaccine's available for them, it's something that I am comfortable with, and not enough knowing the information we know and all of the safety information that's come out, all the studies that have been going on, that I want to and will get my children vaccinated as soon as they're eligible. And that's really all I can say as a parent. And sometimes it's helpful to hear the parent side versus the doctor side. So just trying to relate. I understand that it's stressful. I understand that it's scary. But to try and think about risk, benefit, what we know, it's just the safer choice. Vaccines are always going to be your safer choice against natural infection.
So we actually have a couple more questions.
All right, perfect.
Yeah, that come in. Yeah. So one is, this is a great question. This is again about preparing children more physically to get the vaccine. So are there any things that you recommend about, say, fluid intake? This wasn't a question here, but we've had other parents ask about Tylenol or ibuprofen use before or after the vaccine. So how do you do you have any recommendations around that?
Yeah. So fluid wise, it's always good to drink water and be hydrated. So always, regardless whether you're not getting a vaccine, keep your kids hydrated, make sure they're drinking lots of water. The more hydrated you are, the better you're going to feel when you're sick or post-vaccine. As far as Tylenol or ibuprofen, I don't recommend pre-medicating with that. And that's just because it's going to kind of blunt that immune response. So you want your body to have a really good immune response to the vaccine. Tylenol and ibuprofen might slow that down a bit. That being said, if your child got the vaccine and 8 to 12 hours later, they're feeling miserable, they have a fever. When you have a fever, you don't want to eat and drink, then definitely give your child some ibuprofen or Tylenol, because we don't want them to feel miserable. It's not going to make that significant of a difference in the immune response. They've already had a robust response. That's why they're feeling that way. So it's okay to give them some ibuprofen or Tylenol if they're feeling really awful. But I wouldn't recommend pre-medicating them with that.
And then a couple more questions. So do you recommend that children take vitamins specifically to improve their immune function? Is that something you generally recommend?
So when it comes to vitamins, specifically in Vermont, most kids are vitamin D deficient. So I think vitamin D is good to supplement. A lot of parents ask about elderberry and different things for, vitamin C for immune boost. There's no harm. There's no harm in doing that. Is it going to make a significant difference and really cause a significant improvement in their immune function? Probably not. We don't really have any studies that show that they're super effective in doing that, but it's not going to cause them any harm. So if it's something that gives you as a parent just a little bit more security that they've got a robust immune system, I think it's fine to give, but you don't have to feel like you need to do that.
Thanks for that. I also just remind families too that again, a lot of the damage is not a lack of an immune response, but a robust immune response that's just unprepared. So preparing the immune system with the vaccine is really helpful. So what about this? You kind of touched on this a bit, but maybe we could talk about a bit more. And that is there any data on the vaccine decreasing the possibility of spreading the virus? So I think you had talked a little bit about getting infected, maybe being positive, and how that might be different than severe cases. So how do we think about that with vaccinated people versus unvaccinated people? And maybe if you wanted to add a bit about, again, variants and Delta and Omicron and those.
Yeah. So we do know that if you're vaccinated, you're less likely to shed as much virus. So what does that mean? It means you're less likely to transmit it. And the time frame that you are potentially transmitting it is also decreased. So vaccine does help prevent the spread of COVID. So if you or your child gets infected and you're vaccinated, can you still spread it to somebody else? Yes, but the risk of doing that is significantly lower. And that holds true with the variants. Variants are tricky. So I always kind of explain it as viruses want to survive. And what's the best way for them to survive is to spread quickly and keep their host, us humans, alive. So a lot of mutations have to do with viruses being more transmissible because it's more beneficial to them because they're going to infect more people and stay replicating and stay around. It's less beneficial for a virus to replicate to be more severe because then their host, if their host dies, then the virus also goes with them. So the variants have been more transmissible. And with that, if you're vaccinated and you potentially have Delta variant, the risk of transmitting specifically like within a very close household may be a bit higher than with the original COVID virus, but it's still less if you're vaccinated. So really there's no con as far as transmission to get vaccinated, because you're just going to decrease the amount of virus that you spread in the community.
And yeah, and I would add just for folks who may have joined us late, that the data Dr. Weidhaas presented some data on the data from the Pfizer trial.
Mhm.
And so in that data, you had presented that it was a 90% reduction in getting infected with COVID.
Yeah.
And so I think sometimes people jump to, but then if you get infected, can you transmit it? And I always sometimes say, you can, but like going back, if you never get infected, you can't transmit it.
Right.
So if it's reducing by 90% in the study period, it reduced just even infection.
Mhm.
Then if you're not getting
That
infected,
alone is going to decrease transmission. Exactly. Yep.
yeah. And again, I tend to think of it like you do, where the virus may enter your mucous membranes if you're vaccinated, but again, your body's like, oh, I've seen that before. And is a little bit, and so we know that infectious time period is a little bit shorter in vaccinated folks, just because your body is able to kind of recognize it a little bit sooner.
Yeah.
Yeah. So that's all the questions that we have from our attendees, and we're coming up on time. So Dr. Weidhaas, thank you so much. I don't know if you have any, again, from Springfield Health Center, pediatrics, and we really enjoyed having you. And it's so exciting that you have the vaccine in your office.
We're very happy about that.
Yeah, and I'd just like to give you the last few words.
Yeah, I think in closing, if you have questions about your child and your child getting vaccinated, please call us. If you know right now that you want to get your child vaccinated, call us tomorrow morning. We'll get you in to get your first vaccine. And let's just get these kids vaccinated.
Thanks very much, Dr. Weidhaas. Thanks for all who joined us tonight. The recording will be up on our website. Please feel free to share with friends and family, and have a good night, everyone.
Bye. Thank you.